I want to start by saying something important. Swollen feet and ankles are not just about comfort. They're not just about shoes feeling tight at the end of the day. Very often, they're your body's way of asking for attention. And the way you respond matters. Because depending on the cause, the wrong approach may not help at all, and the right approach can make a real difference in how you feel day to day. If you've ever pressed your finger into your ankle and watched a dent stay there, if your legs feel heavy by evening, if your socks leave deep marks, this video is for you. Tonight, I'm going to walk you through a calm, step-by-step way to understand what kind of swelling you're dealing with and what you can safely do before bed to support overnight fluid drainage. Nothing extreme, nothing rushed, just clear guidance you can use right away. But before we talk about what to do, we need to talk about why swelling happens. Because not all swelling is the same. And treating all swelling the same way is one of the biggest mistakes people make. Let's begin with the most common type, the kind many older adults experience, gravity-related swelling. This happens when fluid slowly settles in the lower parts of your body throughout the day, when you sit too long, stand too long, or when circulation isn't as efficient as it used to be. In this case, swelling often looks like this. It's mild in the morning. It gradually gets worse by evening. Both feet look about the same. This type usually responds well to simple positioning and daily habits. Now, there's another type that behaves a little differently. This one often affects one leg more than the other. It's related to how blood flows back up from your legs. Inside your veins are tiny valves that help push blood upward. Over time, those valves can weaken. When that happens, blood and fluid tend to pool in the lower legs. People often notice a feeling of heaviness, achiness, sometimes visible veins, sometimes skin changes around the ankles. This type usually needs more than just putting your feet up. It responds best to compression and movement. There's also swelling that feels firmer. The skin may feel tight or thick. When you press on it, the indentation doesn't bounce back quickly. This kind of swelling involves the lymphatic system, the body's drainage network. It often develops gradually and needs a gentler, more specific approach. Another common cause is medication. Many people don't realize that swelling can begin shortly after starting a new prescription or after increasing a dose. In those cases, no amount of elevation alone fully solves the problem. The solution often begins with a conversation and adjustment, not a home remedy. And finally, there's swelling that reflects how well the heart and kidneys are handling fluid. This type tends to be more persistent, often affects both legs, and may come with other body signals. This kind requires medical guidance alongside supportive daily habits. Now, here's the key point. Before you try to fix swelling, you need to understand which category it fits into. So let me give you a simple check you can do right now. Sit down comfortably. Press your thumb firmly into the front of your shin, just above the ankle, for about 10 seconds. Then release. If the indentation fades quickly, that tells us one thing. If it stays longer, that tells us something else. Next, look at both legs. Are they about the same, or is one clearly more swollen? Then think about timing. Is swelling worse at night and better in the morning, or does it stay the same all the time? These small observations help guide the right next step. Now let's talk about something very important. Before we go into any evening routine, you need to know when swelling should not be handled at home. There are moments when your body is asking for immediate professional help, not patience. If swelling appears suddenly in just one leg, especially if that leg feels warm, tender, or painful, that's a situation where waiting is not the right choice. If swelling is paired with sudden difficulty breathing, chest pressure, or an unusual sense of exhaustion, those are signals your body is under stress and needs urgent evaluation. If swelling rapidly worsens over a short period of time, or extends far up the legs and doesn't change overnight, that also deserves prompt medical attention. Everything we're discussing in this video is meant for gradual, ongoing swelling without urgent warning signs. For that group of people, which includes many adults over 50, a structured evening routine can be very helpful. So now, let's build that routine. This is not one trick, it's a sequence. Each step supports the next, and when they're used together, the body responds much better than with any single method alone. The first element is proper elevation. Most people think they're elevating their legs when they're really not. Placing a pillow under your ankles is usually not enough. For fluid to move efficiently, your feet need to be positioned higher than your heart. That means your lower legs should be clearly angled upward, not just slightly raised. A foam wedge designed for leg elevation works best, but firm pillows can also work if they support the entire leg, from ankle to thigh. Your knees should be gently bent, not locked straight. The angle doesn't need to be extreme. Comfort matters. The goal is a position you can maintain throughout the night. What's happening here is simple. During the day, gravity pulls fluid downward. At night, when positioned correctly, gravity works in the opposite direction. Fluid gradually shifts back toward the core, where your body can process it naturally. Many people notice they wake during the night needing to use the bathroom more often. That's not a problem. It's a sign your system is releasing excess fluid. The second element is daytime compression, not nighttime. This part often confuses people. Compression is meant to prevent fluid from collecting during the day. At night, when you're elevated, compression is usually removed so fluid can move freely. The most effective type is graduated compression, snug at the ankle and gradually looser as it moves upward. This creates a gentle upward pressure that supports circulation. The timing matters. Compression works best when it's put on before fluid has a chance to settle. That usually means in the morning, before standing for long periods. Wearing it consistently during the day helps reduce how much fluid needs to drain at night. The third element is gentle lymphatic stimulation. This is not deep massage. The lymphatic system responds best to light, slow movements. Before bed, using soft strokes that move upward, from feet toward knees and knees toward thighs, helps encourage fluid movement. The pressure should be light enough to move the skin, not the muscle. This only takes a few minutes, but it prepares your system to drain more effectively overnight. The fourth element is hydration, done strategically. This part feels backward to many people, but when the body senses dehydration, it tends to hold on to fluid. The key is timing. Most fluid intake should happen earlier in the day. As evening approaches, intake naturally tapers. This supports normal kidney function without adding unnecessary fluid right before lying down. Along with hydration, sodium intake matters. Excess sodium encourages the body to retain fluid. Reducing heavily processed foods and focusing on simpler meals can make a noticeable difference over time. The fifth element involves supportive nutrients. Certain minerals help regulate fluid balance and muscle relaxation. Others support healthy circulation. These are not quick fixes. They work gradually, supporting the body's natural systems rather than forcing change. Now let's put all of this together into a simple evening flow. Later in the evening, meals are lighter and lower in sodium. Before bed, gentle leg movements or light massage help stimulate circulation. Then, you position your legs comfortably elevated and allow gravity to assist your body overnight. In the morning, before standing for long periods, supportive compression helps manage the day ahead. Consistency is key. This isn't about doing everything perfectly once. Now let's talk about what most people really want to know. What kind of results should you expect, and how soon? For many people, the first noticeable change is comfort. Shoes feel less tight. Socks leave lighter marks. Legs feel less heavy in the evening. This often begins within the first few days when elevation and daytime support are done consistently. Over the first 1 to 2 weeks, many people notice that swelling no longer builds as aggressively throughout the day. The legs still may not look perfect, and that's okay. The goal isn't perfection. The goal is progress. By weeks 3 to 4, the body often begins to settle into a new rhythm. Fluid accumulation slows. Evening discomfort reduces, and mornings feel noticeably lighter. Now, let's talk about common obstacles because they do come up. One of the most frequent concerns is sleep comfort. Sleeping with elevated legs can feel strange at first. That's normal. The body adapts. If full elevation feels uncomfortable in the beginning, start lower and gradually increase over several nights. Comfort always comes first. A position you can maintain is far more effective than a perfect position you abandon halfway through the night. Some people do better sleeping slightly on their side with leg support. Others prefer their back. There is no single correct posture, only what allows your legs to remain supported and relaxed. Another concern is mobility. If you have joint stiffness, back discomfort, or limited movement, focus on what you can do. Daytime support, gentle evening movements, and consistent habits still help. Even if full elevation isn't possible every night, small, steady improvements matter more than intensity. Now let's talk about something many people overlook. Swelling affects balance. Heavier legs change how you walk. Reduced sensation in swollen feet affects stability. Shoes may fit poorly, increasing fall risk. That's why addressing swelling isn't just about appearance or comfort. It's about protecting your independence. While swelling is present, move more deliberately. Use handrails. Wear supportive footwear. Give yourself time. As swelling reduces, balance often improves as well. There's also an important mindset shift to make. Swelling is not a personal failure. It's not something to ignore. It's a signal. And when you respond calmly and consistently, your body often responds back. This routine is not a one-night solution. It's a supportive pattern. Some nights will feel better than others. That's normal. What matters is staying steady, not getting discouraged. Before we finish, let me give you a clear checklist to remember. Understand what type of swelling you're dealing with. Pay attention to body warning signals. Support circulation during the day, encourage drainage in the evening. Position your legs comfortably overnight, repeat consistently. That's it. No extremes, no rushing, just steady care. If you found this helpful, consider staying connected. I share calm, practical guidance designed for adults who want to stay comfortable, mobile, and confident as they age. And if someone you care about struggles with swollen feet or ankles, sharing this information may help them feel less alone and more supported. Your legs have carried you through decades of life.